Okay, so let's cover the dural venous sinuses now, all right? So we've already established that the dura actually has two layers, right? It has one layer that is called the meningeal layer that will be lying, well, to where the other meninges are, so right on top of the arachnoid and the pia, and the other one's the periosteal layer that will be the one that is directly next to the skull, or directly next to the bone, peri and ostium, all right? So basically the dural venous sinuses are endothelial line spaces that are between these two layers, between the periosteal and meningeal layers of dura, okay? They will form exactly there where the dural infoldings attach. So you have really large veins on the surface of the brain, and well, the veins from the brain, but also the veins from the layer of bone called the diploe between the two tables of the skull, and all the blood from the brain, of course, will drain into these venous sinuses. Okay, so if we have a look at these, we have some labels on here. We have the biggest one is called the superior sagittal sinus. Okay, the superior sagittal sinus. Let me move this out of the way and zoom out a little bit. You can see how far it expands, or extends actually. Okay, it'll reach all the way from the crista galli up front here, or anteriorly here. It runs in the convex attachment of the border of the falx cerebri, which is the infolding of the dura that separates the right and left hemispheres of the brain, and it'll end right there where the internal occipital protuberance is on the bone at an area called confluence of sinuses, which is right here because this is where all the sinuses come together. Okay, so the superior sagittal sinus will be receiving several things, for instance, cerebral veins, and it'll communicate on each side through slit-like openings with things that are called lacunae, or lateral venous lacunae, which are basically lateral expansions of the superior sagittal sinus that you can see going over here. Yeah, what's called superior cerebral veins. You will also find in the superior sagittal sinus, you will find things called arachnoid granulations, which are protrusions of the arachnoid villi that go into the superior sagittal sinus, because we know that in the subarachnoid space you have cerebrospinal fluid. Well, and through the arachnoid granulations, it gets resorbed into the venous circulation. If we have a superior sinus, or just in general in anatomy, the rule is usually if there's a superior, there better be a what? An inferior. If there's a major, there's a minor. If there's a medial, there's a lateral, and so on and so forth. If there's a superficial, there's a deep. You get the gist? All right. So here is your inferior sagittal sinus. Okay, it's much smaller than superior sagittal sinus, and it'll run in the inferior, free, and also concave border of the falx cerebri, right? So you'd actually have the falx cerebri right here that connects the superior and inferior sagittal sinus. Then you have the straight sinus here, and as the name implies, the straight sinus goes straight down here. It's actually formed by the union of the inferior sagittal sinus with the great cerebral vein. Well, the great cerebral vein is not indicated here. However, it's also called the great vein of Galen, who was a famous anatomist, would actually be attaching just about here where the mouse is indicating now. Okay? And then the straight sinus will run straight, but inferiorly and posteriorly, so infero-posteriorly, all the way down to the confluence of sinuses down here. Then from the confluence of sinuses, you can already see that there are more sinuses coming off of there. For instance, you have the left and right transverse sinuses here. The transverse sinuses will pass laterally from the confluence of sinuses all the way along the posterior margin within the bone, the occipital bone here, and in the margin of the tentorium cerebelli, which we know is the dural fold that actually keeps the cerebellum in place. Then the transverse sinuses will change their name into the sigmoid sinuses, which are called sigmoid sinuses because they're more or less S-shaped. Okay, so they will course in the posterior cranial fossa, forming pretty deep grooves within the bone, so you can easily see those, yeah, both in the occipital and in the temporal bone. And each of these sinuses is then going to turn anteriorly. Let me turn this for you. We're going to do the same anterior turn. We're We're going to zoom in a little bit because now we're going to learn where they actually exit. So the sigmoid sinuses continue inferiorly as the internal jugular vein as they traverse the jugular foramen that we can see right here. We also have, coming from superiorly here, the inferior petrosal sinus, which, if we follow it superiorly, comes all the way from, my favorite, the cavernous sinus. Yeah? As I've said before, if there's an inferior petrosal sinus, there's going to be a superior petrosal sinus. And that actually runs from the posterior end of the cavernous sinus. It's like a cave. There are two of these. Yeah, the sinuses that are connecting these two are called the intercavernous sinuses. Duh, right? Well, anyway, so you have the cavernous sinuses, you have the superior and inferior petrosal sinuses here, and each one of these petrosal sinuses will lie in the anterolateral margin of the tentorium cerebelli. Remember, the tentorium cerebelli would be lying right about here, and it'll cause a separation between the cerebellum and the cerebrum, which is the rest of the brain. Maybe I can add in some of the connective tissue for us. Hold on. See, now I've added in a lot of the nerves and also the dural infoldings. So you can really nicely see the falx cerebrum here. You can see the superior and inferior sagittal sinus. You can see the tentorium cerebelli. And so the cerebellum is going to be below it. Then if we turn this and move a little bit like here, you can see that indeed the straight sinus runs straight down here, all the way down to where the confluence of sinuses is going to be right down here. And joining it from inferiorly is the occipital sinus. And now let's rotate this way around and have a look at the cavernous sinuses. Okay, here's your left and your right cavernous sinus. The cavernous sinuses are important for several reasons. As you can see, they're located bilaterally on each side of the Turkish saddle, aka the sella turcica, which is right here. We can see there's a little but important endocrine gland missing that will be sitting right here, which is the pituitary gland. And the cavernous sinuses, they basically consist of a pretty complex venous network. They're pretty thin-walled, and they extend all the way from the superior orbital fissure, so from up here, to the apex of the temporal bone posteriorly. And the cavernous sinuses will actually receive blood, or venous blood, from the ophthalmic veins. So both the superior and inferior ophthalmic veins, and in addition, from the superficial middle cerebral vein, the so-called sphenoparietal sinus, and also the venous channels within the cavernous sinus will communicate with each other through the intercavernous sinuses, as I have mentioned previously. And you can see that they will be running anteriorly and posteriorly to the region where the little pituitary gland would be sitting. See, I've added back the dura and the arachnoid. So if we zoom in, and we're just going to pop in right through into the cranial cavity. Boom, there we are. And look what we can see here. Here you have your optic nerves on the right and on the left. Well, to make this easier, why don't I just go ahead and hide the right one. And look at this thing here. This funny little thing is the infundibulum, which is coming out of the pituitary. And you can see how it actually comes out of the little hole here. And the membrane on top of it is actually, well, here it says it's cranial arachnoid mater. However, there's also dura. So if I hide this, you can see that was the arachnoid. This is the dura. And this little membrane that is holding the pituitary in place is called the diaphragma sellae. So it's a diaphragm that holds the pituitary in place. It's called diaphragma sellae because it's where the sella turcica is. Now we look down here. Here's your pituitary. And so why is this cavernous sinus so important? Well, exactly because of all of those connections with veins, especially the ones that originate in the face, because if I add them all back in here, you might recall that the veins in the face do not have valves, and although blood should actually flow away from the cranium, if you have an infection in the face like thrombophlebitis and maybe staph, it can go via the ophthalmic veins all the way into your cranium. And that is bad news, because then you have a bacterial infection in your cranial cavity, which can, if left untreated, can lead to death. Interestingly enough, if we have a good look at the cavernous sinus, we can see that there are also several cranial nerves running right through here, right? We can see there are branches of this one, which is your oculomotor nerve. There is also the trochlear nerve and the abducens nerve. The abducens nerve is the one that is most in danger because it will actually not be embedded in dura. It is completely free, and so it will be the first one to be affected by an infection of the cavernous sinus. And with the orbit lecture, we will talk about what then actually happens. The abducens nerve will abduct or abduct the eyeball. Well, if this nerve is damaged, you will not have abduction or abduction anymore. So your eyeball will be directed a little bit towards the midline and will fail to abduct from the primary position. One more thing to point out here, and you can see it's getting very busy because there's a whole lot of infrastructure happening here. Let me hide some more of the veins. So we have our superior and inferior petrosal sinuses. So now you can see the cavernous sinus, but you can also see the superior petrosal sinus running here, the inferior petrosal sinus running downwards, and the superior bulb of the IJV. And so the inferior petrosal sinus is going to commence at the posterior end of the cavernous sinus here and here. That means these are going to be veins through which the cavernous sinus is being drained. And the inferior petrosal sinuses drain the cavernous sinus directly into the IJVs, or internal jugular veins. Also, there is a basilar plexus of veins that will connect the inferior petrosal venous sinus, or the inferior petrosal sinus, and communicate with an internal venous plexus. And there's one more category of veins which are called emissary veins. Those are veins that will actually be able to traverse the cranium and connect the dural venous sinuses with the outside of the cranium. Now you can imagine if there are any veins that traverse the skull or form any kind of communication or potential communication between the inside, which is sterile, and very sensitive, to the outside, which can be very, very dirty, this poses an enormous risk factor.